Hi, Andrew Penn here, talking about this last section of ADHD management, which I'm going to talk about how to manage risks associated with this treatment. And that's going to include side effects and also ways of preventing medication misuse and diversion. So some basic drug-drug interactions. You don't want to administer stimulant medications with MAO inhibitors because it will slow the breakdown of the stimulant and potentially lead to hypertensive problems. But since MAOIs are rarely prescribed, this is more of a board's question, honestly, than a clinical situation you're likely to encounter. Now, there is a theoretical risk, and you'll get flags from the pharmacy about the risk of serotonin syndrome when you give an SSRI plus a stimulant. In general, this is something that can be managed clinically. You certainly want to keep an eye out for it, but it's uncommon. And also some 2D6 inhibitors can raise the levels of amphetamine, so that's something to keep in mind too. Now, with all stimulant medications, the primary risks are things like dry mouth, insomnia if it's taken too late in the day, because really, remember, we're working with pharmacokinetics here, because if you think about it, most medications need to be taken daily. They need to be at a steady state. With stimulants, you want them in and out during the waking hours of the day. So this is why somebody might take a stimulant, say, just a few times a week, for example, and that's fine, because if they're only taking it on, say, days that they have school, that's a reasonable thing to be doing. With younger people, you're probably going to want to be doing it on a daily basis with young children. Most stimulants will decrease appetite, and so you need to keep an eye out for weight loss. And you can see some tachycardia with stimulant medications. So as I mentioned earlier, if somebody has cardiac issues such as uncontrolled hypertension or a history of unstable angina, or recent MI, you're going to want to run this past cardiology before you start it. Many people feel jittery and anxious from stimulant medications, particularly the immediate release medications. And as we see down the chart here, there are some other side effects that can occur, such as constipation. In young children, we definitely can see suppression of growth in height with children who are taking stimulants. And because of the noradrenergic tone of the medication, this can cause vasculopathy, or if somebody has something like Raynaud's syndrome, you can see constriction of blood vessels in the periphery, which can worsen Raynaud's syndrome. Now, in rare cases, this can induce mania or psychosis. Psychosis is usually going to require a large dose of the medication, typically taken over a sustained period of time, as we see in methamphetamine users. And there can become a tolerance to this medication. So fortunately for most people with ADHD, they will be on a steady state of the medication for the foreseeable future. And I don't see a lot of need to escalate the dose, but there does appear to be a subset of patients that do need occasional increases in their dose. And the bigger concern that I have around stimulant medications, because they are Schedule II drugs, is the risk of diversion. And so a couple of ways that you can mitigate that is, one is I use a controlled substance contract in my practice. And I do this with, I try and do it with everyone, so I can honestly say that I'm not picking on anybody. I just want to make the expectations really clear. And the contract just spells out, I try and write it in fairly clear language. I'll put it up on the website so you can download it, and it's in a Word file so you can adapt it to your own practice. But really what this does is it spells out some things that we often assume patients know, but we're not explicit about. Like, so what is an on-time refill? And so in on my contract, it's within 5 days of when I would expect you to run out of the medication. And I also lay out when I would have concerns or suspicions, like somebody repeatedly losing their medication. And that is something you're going to deal with patients with ADD, because unfortunately the nature of their condition is often to be distractible. And so I've had patients I've treated who left their medication in hotel rooms and had it stolen out of cars and things like that. Now, of course, if that's happening several times a year, I start getting a little suspicious. But it just lays out the terms of our treatment, and it says that I can ask for a pill count if I need that. I rarely ever use that, but I have that as an option. I can get a tox screen to make sure that they are actually taking the medication, etc. And most patients are just fine with that. And I just say, you know, I trust everyone until I have a reason not to. So I just want to be really clear about our engagement. And then also, you need to regularly check the prescription drug monitoring program, PDMP. In California, we call it the Cures database. This is administered by the Department of Justice, and it allows you to look up controlled substance prescription records regardless of who they came from. So this really should be in your workflow before you prescribe or refill a new controlled substance, to make sure that they aren't getting it from multiple sources. It's uncommon to find that, but it does occasionally happen. And of course, that would warrant a conversation with your patient. I also invite you to check out StreetRX.com. This is kind of a very interesting crowdsourcing site. As you can see from this screenshot here, these are Adderall prices in Northern California. So your prescription 25 milligram Adderall is going for $6 to $10 a pill. And the vast majority of patients are never going to divert their medications, but there are certain populations that I think are higher risk for doing this, particularly young people, particularly college students. I always tell my young patients, don't tell your friends you're taking this medication, because the last thing you want is a knock on your dorm room at midnight during term paper week asking for one of your friends asking for one of your Adderall pills so they can do an all-nighter. Just say, this is, be discreet with this, keep it in a safe place, and don't leave it out in the open. But I invite you to take a look at this page. It's open to the public, and take a look and see what the medications you prescribe are worth. So in summary, most common side effects are pretty tolerable. They're things such as headache, reduction in appetite, insomnia, and anxiety, and we can see growth suppression in children. You do want to be especially careful in patients who have cardiovascular histories, especially uncontrolled hypertension or recent MI or arrhythmia. And really, this is a great opportunity to have really clear communication with your patients and frank conversations about expectations in a non-pejorative way, where everyone is clear about the expectations from the beginning. I hope this has been helpful, and I hope it helps you treat your patients with ADD. Thanks. Bye.